Hi, my name is Lisa Jonkind. I'm a physical therapist. I've been with HTS for 5 years, and I've been a clinician for 25 years. I started accepting students 1 year after graduation. The facility that I have previously worked for, they had a very strong student program. So we were encouraged to take students within a year of graduation. So started accepting students 1 year out. A normal day for me and a student is usually I will start in the morning. I'll print off our schedule. We'll go over the schedule and kind of make sure that she's understanding like how much time we need to spend with each patient. So we'll go through that. We kind of make a plan of attack, where we're going to start that day, who we're going to start with, and how we're going to move through it. We also take note of who needs progress notes, who needs discharges, who's in evaluation. So that starts her thought process thinking right away. Okay, this one is a progress note, so we have to reassess goals today, or this is a discharge. We have to, set up the restorative plan, look at whether all goals have been met, or it's an evaluation. This is the diagnosis. What kind of a test am I going to do? What kind of paperwork do I need to do? What kind of a chart review? Where can I find that? So we usually go over that, and then we'll get started with our day. And I'm always with the student when they're doing treatment. And we'll just, we kind of go through the treatment. In the beginning, I'm right next to them, kind of whispering in their ear a little bit. Ask them this question. Don't forget that, that type thing. But as they become more independent, I'm maybe a few feet back, and I'm the one pushing the wheelchair. They're the one walking with the patient. And I might still be whispering at them, maybe a little bit louder because they're a little further away. But you're just with the student, and as they become more independent, you get to step back a little bit more. You become more of a watcher, you're there to answer questions for them. You're there to give advice. And maybe you don't get as much hands-on while you have a student, but it does give you an opportunity to kind of teach them. So as we go through our day, we'll just kind of get our documentation done. And as they become more independent and they're beginning to manage the schedule more, I will, I'll say, we've got 3 evals today, and let's get that done. And maybe I don't do much typing that day. They do most of it. I just go back and check it all and make sure we've crossed all of our T's and dotted all of our I's, and we're good to go. So, and then we usually kind of regroup at the end of the day. We'll talk about what's going to happen tomorrow, how the student did, and just plan for the next day. Now that Indiana requires physical therapists and physical therapy assistants to have CEUs for license renewals, you can earn your CEUs while being a clinical instructor. For every week that you have a student, you earn 1 CEU. And according to Indiana regulations, you can earn half of your required CEUs just by being a clinical instructor. So that is definitely a benefit that you can take advantage of, and doesn't cost you any classroom time.